And that, my esteemed colleagues, is why proper decontamination protocols require 7 distinct sterilization frequencies. Professor Dorax announced, his 4 purple eyes blinking in perfect synchronization as he gestured with his upper limbs. The holographic display behind him showed meticulous, color-coded charts that could put an accountant to sleep faster than general anesthesia. The lecture hall of the Galactic Medical Institute, affectionately called the Slice by its students, hummed with the soft whirring of recording devices. 26 alien residents from 17 different species sat in perfect posture, their attention unwavering. Not because Professor Dorax was particularly engaging, but because Zentorian physiology made slouching physically impossible. Questions? Comments? Existential doubts about your career choices? Dorax's mouth tendrils wiggled in what passed for humor among his species. Dr. Nexel raised a tentacle. Professor, isn't the 7th frequency redundant when dealing with carbon-based pathogens? Hey. Excellent observation that would be completely correct if you weren't completely wrong. Dorax's exoskeleton rattled with delight, which brings me to today's announcement. The professor's tone shifted as he straightened his formal medical vestments. The Galactic Council has approved our first and possibly last, depending on how this goes, human exchange program. Tomorrow we welcome Dr. Lyra Patel from Earth. A murmur rippled through the lecture hall. But sir, Dr. Branthos called out, mandibles clicking nervously, humans still use manual incision tools. With metal. They physically cut into patients. Yes, absolutely barbaric, Dorax agreed, his secondary breathing sacs inflating with resignation. But apparently they've survived this long despite themselves. The Council believes we might learn something from their, what did they call it? Oh yes. Their trauma response adaptability. Personally, I'm not convinced, but orders are orders. The arrival bay doors hissed open, revealing a short figure in rumpled blue scrubs. Dr. Lyra Patel strode in with a coffee tumbler in one hand and a duffel bag slung over her shoulder. Her dark hair was pulled back in a practical ponytail, and a scar ran across her left eyebrow, a souvenir from her first deployment as a combat medic. Sorry I'm late. Had to finish a double shift before catching my transport. Someone thought scheduling interstellar travel right after a 36-hour trauma rotation was efficient, she announced to the waiting aliens, grinning broadly. Nice place you've got here. Very sterile. Professor Dorax's mouth tendrils curled inward in disapproval. Dr. Patel, punctuality is considered a medical virtue in civilized systems. I am Professor Dorax, Department Head of Universal Medicine and author of 27 definitive texts on non-invasive healing methodologies. 27? Wow. I've written exactly 0 books. But I did once perform an emergency tracheotomy with a ballpoint pen, so we've both got our achievements, Lyra replied, extending her hand before remembering the no-contact protocol and awkwardly converting the gesture into a wave. From the back of the reception committee, a tall, willowy alien with translucent skin through which complex organs pulsed in fascinating rhythms stepped forward. I'm Dr. Nexel, 3rd cycle resident in emergency medicine. I've studied human medical journals extensively. Is it true you still use adrenaline to restart cardiac functions? Fascinating application of hormonal shock therapy. Lyra's eyes lit up. Oh, you've read our journals? We should talk about. We should discuss nothing that violates our prime medical directive of do no unnecessary harm, interrupted Dr. Branthos, a stocky practitioner with metallic scales and 6-fingered hands that never seemed to stop moving. I've reviewed human medical practices. You cut people open, remove organs, then put them back. You set bones by breaking them further. You use toxins as treatments. It's medieval at best, criminally negligent at worst. Lyra's smile didn't falter. Dr. Branthos, right? Looking forward to changing your mind. Sometimes the messy way is the only way when you've got seconds, not hours, to save a life. Professor Dorax made a sound like a deflating balloon. May the medical gods give me patience. The exchange program officially begins tomorrow at first rotation. Dr. Nexel will show you to your quarters, Dr. Patel. Try not to cut anything while you're there. Lyra whistled as she followed Dr. Nexel through the medical ward. So you're telling me you never touch your patients? At all? Of course not. Nexel's translucent skin flushed pink with shock. Direct contact introduces unnecessary variables. Our nanomolecular field generators create targeted healing environments around the affected areas. They passed a treatment room where a patient floated in a glowing green suspension field. 3 doctors stood at separate consoles, their appendages dancing over holographic interfaces. That's cool and all, but how do you know what's happening inside without feeling it? Lyra asked, peering through the observation window. Feel it? Why would we need to feel it? Nexel's voice modulator registered genuine confusion. Later, during the medical history seminar, Lyra's presentation on Earth's medical evolution caused near pandemonium. You drilled holes in skulls to release evil spirits? Professor Dorax's voice reached a pitch previously unknown to science. Well, yes, but that was thousands of years ago, Lyra clarified, advancing her slide to show modern brain surgery. Now we drill holes in skulls for completely legitimate reasons. Dr. Branthos actually fainted when Lyra described emergency field amputations. 2 medical assistants had to carry him out. But the fundamental difference, Lyra explained over lunch in the nutrition chamber, is that human medicine developed under constant pressure. We can't wait for optimal conditions. We've always had to work with what's available. Professor Dorax's feeding tentacles recoiled from his meal. That's precisely what's wrong with your approach. Medical intervention should never be improvised. It must be calculated, precise, and follow established protocols. And when those protocols fail, Lyra challenged. Proper protocols don't fail, Dorax insisted. They simply require appropriate technology and correct application. Nexel, who had been unusually quiet, finally spoke up. But what about species we've never encountered before? Or new diseases? Or catastrophic events where equipment fails? Dorax's 4 eyes blinked asynchronously, the alien equivalent of an eye roll. Then we stabilize and wait for proper resources. We don't resort to barbarism. Lyra smiled into her food cube. Let's hope you never have to find out which approach works better in a real emergency. The emergency alert blared through the slice with a harmonized 3-tone wail that made Lyra's fillings vibrate. What's happening? She asked, jogging alongside Nexel toward the emergency transport bay. Shuttle collision at the orbital station. Multiple casualties of various species incoming, Nexel explained, their translucent skin now pulsing with stress-induced bioluminescence. This is the largest mass casualty event we've had in 7 cycles. The transport bay doors whooshed open to reveal chaos by Galactic Medical Institute standards, which meant everything was still alarmingly orderly. 8 patients on hover gurneys were being systematically processed through decontamination fields, while medical staff consulted tablets and called out readings. 8 patients, 6 experiencing rapid cellular degradation. Molecular field generator calibration at 63% effectiveness. 1 technician announced. Professor Dorax swept in, his medical vestments billowing dramatically. Deploy secondary nano-reconstruction matrices. Begin quantum tissue stabilization sequence. Lyra rushed to the side of a human patient whose chest was heaving with labored breaths, blood bubbling from a puncture wound with each exhalation. This one has a tension pneumothorax, she shouted, reaching for her emergency kit. Dr. Branthos intercepted her. Step away, Dr. Patel. The diagnostic systems will identify optimal treatment parameters in approximately 7 minutes. He doesn't have 7 minutes, Lyra protested, pointing to the patient's blue-tinged lips. I need to release the pressure now or he'll die. We cannot abandon protocols, Professor Dorax insisted. gliding over. The calibration sequence for human physiology requires. Screw the calibration. Lyra pulled a large bore needle from her kit. I'm doing this the human way. Professor Dorax's exoskeleton rattled with alarm. Absolutely not. Security, restrain Dr. Patel. She's attempting to puncture the patient with a primitive metal implement. Two security drones flanked Lyra as she backed away from the patient, frustration evident on her face. Your patient, your rules, she conceded, watching the human's oxygen levels drop on the hovering monitor. But while your machines are calibrating, you've got 3 other patients crashing. That Zentorian is going into shock. The Malorian is having some kind of seizure, and whatever species that blue guy is, he's not supposed to be that color, right? The emergency bay erupted into even more frantic activity as monitors began alarming in synchronized urgency. Professor Dorax's eyes darted between failing patients. Proceed with standard emergency protocols. Recalibrate all systems. Lyra clenched her fists, watching helplessly as the situation spiraled further out of control. Cellular regeneration failing. Called out a technician as the human patient's vitals plummeted on the hovering display. Field generator effectiveness down to 28%. Professor Dorax's tendrils twisted in agitation. Impossible. Increase power to compensatory levels. Sir, we're at maximum output. Dr. Branthos reported, mandibles clicking frantically. The damage is progressing faster than our systems can repair. Lyra had been watching the chaos unfold, mentally counting down the human patient's remaining minutes. When his oxygen level hit 62%, she made her decision. Sorry about your protocols, she muttered, shoving past the distracted security drones and lunging toward the patient. In one fluid motion perfected through years of battlefield medicine, Lyra pulled a large bore needle from her pocket, identified the second intercostal space, then plunged the needle into the patient's chest. A loud hiss of air escaped, followed by the patient's immediate gasping inhale. What have you done? Professor Dorax bellowed, all 4 eyes bulging in horror. Needle decompression, Lyra explained, securing the makeshift chest tube with to the alien's further shock adhesive tape from her pocket. His chest cavity was filling with air, compressing his lung and heart. I just let the air out. With a metal stick. Dr. Branthos looked ready to faint again. Look at his stats. Lyra pointed to the monitor, which showed rapidly improving vital signs. Professor Dorax stared in disbelief. The barbaric approach worked? Sometimes you don't need a molecular field generator, Lyra said, already moving toward the seizing Malorian patient. Sometimes you just need a sharp object and the guts to use it. Now, does anyone have a benzodiazepine equivalent for this species, or am I improvising again? Because I'm thinking that serving spoon over there could work as a tongue depressor. The assembled alien medical staff looked at each other in stunned silence. What in the 7 galactic hells are you doing now? Professor Dorax shrieked as Lyra fashioned a tourniquet from a medical tubing and a stylus. Stopping this Andorian from bleeding out, she replied, cranking the makeshift tourniquet tighter around the blue alien's upper limb. The patient let out a gurgling cry of pain. You're hurting them. Dr. Branthos protested, his metallic scales flaring in distress. Temporarily, Lyra corrected, securing the tourniquet, which is better than permanently, as in dead. Get me something to clot this wound, your version of quick clot, hemostatic gauze, hell, I'll take super glue at this point. Dr. Nexel, who had been observing Lyra with increasing fascination, hurried over with a small canister. Would bioactive coagulant foam work? Perfect. Lyra sprayed the foam directly into the gaping wound, ignoring the horrified gasps from the alien medical staff. See? I can use your fancy tech too. I just don't need it to be perfect before I act. Across the emergency bay, monitors began showing stabilization of vital signs for patients Lyra had treated. Meanwhile, those still receiving the standard alien protocols continued deteriorating. Professor Dr. Nexel said cautiously, Dr. Patel has stabilized 4 patients in the time our systems have failed to calibrate for 1. Professor Dorax's exoskeleton vibrated with indecision. This violates every principle of non-invasive medicine we practice. With respect, sir, Lyra intervened, wiping fluorescent blue blood from her hands. Your principles assume you have time. Emergency medicine is a different game entirely. On Earth, we developed battlefield medicine, the art of keeping people alive with whatever you've got on hand. She gestured toward the Zentorian she had treated by manually repositioning its displaced organ sacs. But sometimes that means getting your hands dirty. Sometimes it means causing pain to prevent death. It's not pretty, but it works. But the psychological trauma of such invasive procedures, Dr. Branthos began, is better than the psychological trauma of being dead, Lyra finished. Look, your technology is amazing, but it's useless if the patient dies while you're calibrating it. Human medicine evolved from necessity, from facing death daily with nothing but our hands and whatever tools we could scrounge up. A junior medical technician approached timidly. Professor, the remaining patient's cellular degradation is accelerating beyond our capacity to compensate. Professor Dorax's 4 eyes darted between the failing patients and those stabilized by Lyra's unorthodox methods. His mouth tendrils drooped in what appeared to be surrender. Dr. Patel, he said, his voice modulator set to minimal volume, perhaps you could demonstrate more of your emergency techniques? For educational purposes only, of course. Lyra's face broke into a wide grin. I thought you'd never ask. Nexel, grab that medikit and follow me. Branthos, find me something absorbent, we've got some improvising to do. Incoming. Second wave of casualties. The announcement blared as transport doors slid open, revealing 6 more injured beings on hover gurneys. This time, instead of pushing Lyra aside, Professor Dorax turned to her. Dr. Patel, your assessment would be valued. Did that hurt to say? Lyra asked, already moving toward the new arrivals. Immensely, Dorax admitted, his exoskeleton clicking with what might have been a chuckle. Lyra quickly triaged the patients, calling out instructions. This one's airway is compromised, Nexel. Remember that jaw thrust maneuver I showed you. The crystalline being is leaking fluid, we need pressure on those fractures. And whatever this fuzzy thing is, its hard equivalent is in fibrillation. To her surprise, the alien medical team jumped into action, following her lead with only minimal hesitation. Why not use a cellular stabilizer? Dr. Branthos asked as he applied pressure bandages to the crystalline being. Because Lyra explained while manually repositioning a dislocated limb, emergencies are about time and resources. First rule of human emergency medicine, treat what kills first. Airway, breathing, circulation, the ABCs. Everything else is luxury. Dr. Nexel was proving to be a natural, mimicking Lyra's hands-on techniques with remarkable precision. It's like solving puzzles with your hands. I can feel the tissue response instead of waiting for sensor feedback. Exactly. Lyra beamed while instructing another doctor on splint placement. Your technology is amazing for perfect repairs, but our methods are about keeping patients alive until they can get that perfect treatment. As the crisis subsided, with all patients stabilized, Professor Dorax observed the scene with a mixture of horror and reluctant admiration. Your methods are barbaric, primitive, and alarmingly intimate, he said finally. And they appear to work with remarkable efficiency in crisis situations. Lyra wiped alien fluids from her hands. That might be the nicest thing an alien has ever said to me. 2 weeks later, Professor Dorax stood before the Galactic Medical Institute's governing board, his posture so rigid he appeared to have swallowed his own medical scanner. And therefore, he concluded, mouth tendrils barely moving, I propose a new integrated emergency curriculum that combines our advanced technologies with selected human methodologies. The board members' various appendages twitched with surprise. Are you suggesting we adopt primitive contact techniques? asked the chairperson, a gelatinous entity whose voice bubbled from multiple orifices. Emergency situations only, Dorax clarified quickly. Dr. Patel has demonstrated that in crisis scenarios, when seconds count, sometimes the direct approach has merit. Later, in a newly designated tactical emergency response lab, Lyra watched with barely contained laughter as alien doctors of various species attempted to apply tourniquets to practice dummies. "No, Dr. Branthos, you need to twist it tighter," she instructed. "Don't worry about hurting the dummy. It can't feel pain, unlike you when you fainted at my presentation." "I did not faint," Branthos insisted, his metallic scales flushing a deep copper with embarrassment. "I experienced a momentary gravitational realignment." Nearby, Dr. Nexel had become surprisingly proficient, their translucent hands confidently performing manual techniques that would have been scandalous just weeks before. "I've been studying Earth's military field medicine manuals," Nexel confessed. "The ingenuity is astounding. Did you know humans once used crayons to seal chest wounds?" Professor Dorax entered the lab, surveying the scene with his 4 eyes blinking in sequential disapproval. "Dr. Patel," he said, approaching her station, "the board has approved your extension for a full teaching cycle. Apparently your barbaric techniques have reduced our emergency mortality rate by 63%. Lyra grinned. "Admit it, Professor. Sometimes the messy way is the right way." "I admit nothing," Dorax replied, his mouth tendrils curling into what might have been a smile. "Except that perhaps occasionally when all else fails humans might be onto something." "Coming from you," Lyra laughed, "that's practically a marriage proposal."